All right, let's see if we're on here. And greetings and salutations. Hi, this is Blackout, aka Michael Biggins. And I have to tell you, I have not been doing good. That's why I haven't been putting out that much stuff. I've been going through horrific symptoms. I don't know if it's the black mold poisoning. I mean, if I believed in this whole COVID schmovid thing, maybe it's a bacterial thing, but I've had just felt terrible. Anyway, a lot of people were asking me to find some footage of our good old man, Kill Bates, they like to call him. And I saw a clip kind of floating around. It was very edited. And then I tried to find this. It was CBS Evening News. I can't remember the anchor's name off of the top of my head, who she is. I don't really follow the news. It's just all the same garbage. The fact that they even give this man time who has nothing to do. He's not a scientific background. He has no knowledge on what he's talking about. He just is a billionaire who has power and ran a computer company. What gives you the right to speak on putting alien foreign substances into the entire human race? What gives this man the right to speak to everyone and tell them what to do? Other than the fact that, he's paid the mainstream news to do this. But this is a feisty reporter here, so I'm going to let him watch the body language and watch him just squirm his way out. We're going to I forwarded about, 11 minutes, because it's just a lot of babble and introducing him and his foundation and blah, blah, blah. We all know the Bill and Melinda Gates Foundation, wah, 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 wah. So we're past all that. We're getting into the meat right here. I think she flat out says, what's going on with the trials, and she brings up the fact that 80%, and actually I heard it was almost up to 100%. So the trial information is out. Certain doctors do have their hands on this information. Obviously, the news got hands on their information. I'm surprised this aired on CBS Evening News. Let's just go to the clip, and you get an idea. Here we go. Roll it.
What do you make of the results from AstraZeneca and Moderna?
Oh.
Well, it's very hard to characterize complex scientific things in a sort of simple to understand format. We don't know if these vaccines will work. We don't know if they'll work to avoid deaths. We don't know if they'll work to avoid transmission.
Sounds pretty goddamn simple to me there, Bill. Well, we don't first listen to him squirm at the question. He squirms. And then he's like, well, there's really no way to put human terms to my robotic AI mind. But basically, we don't know if this will work. We don't know if it'll hurt people. We don't know if it'll do anything. But you have to take it, cause me. Whoop-de-doo. Hey. You looking like an evil ruler. Hey, Fabba Abba Wabba, Bill Gates, Wamba Kilba Hoba Wubba. Cause he's power hungry. And whoever he is, someone behind him. Mm-hmm. Let's continue. Again, notice the squirming. Now, there's no way to put it into words. I can't really talk about. Basically, we don't know if it's going to work. We don't know if it's going to hurt you. We don't know if it's going to do anything. But you have to take it.
Front. What do you make of the results from AstraZeneca and Moderna?
Well, it's very hard to characterize complex scientific things in a sort of simple to understand format. We don't know if these vaccines will work. We don't know if they'll work to avoid deaths. We don't know if they'll work to avoid transmission. That's why.
Again. Make up your mind. Either we can't communicate it, or, we don't know if it'll work to avoid death. We don't know if it'll work to avoid transmission. We're just going to inject some motor oil and hope for the best. Absolutely insane. All right, let me let this go on. My God.
Why we're working on so many first-generation vaccines and a whole bunch of second-generation vaccines.
Now, who's the we and where? I mean, I assume he means his Bill and Melinda Gates Foundation. Why is this man so obsessed with this? Who does he think he is?
That, you know, although they'll take more time, they...
Okay, COVID-19 vaccines currently in phase 3. Mind you, phase 3 should take years. Okay, so you got, Oxford, AstraZeneca, whatever the hell that is. What the hell's that logo? Oh, look at this. The Chinese company involved in there. Oh my God, but I thought it was the China virus. Oh wait, no, he's a Democrat. Murdoch Children's Research Institute. Yeah, there's nothing pedo about that whatsoever, but... All right, let's go on.
They are more likely to be extremely effective. It's great the U.S. government has been willing to fund vaccine manufacturers. Our foundation is partnered with them on that. That's something in my regular phone calls with Dr. Fauci we update each other on. Okay, how are we working with various companies? You know, which ones do we think we need to add to the mix there? What is the scalability going to be so that not just the U.S. but the entire world gets the vaccine?
I mean, he's like literally the evil dictator. The entire world must take my creation. It's mind-blowing.
So yes, I am very hopeful in innovations in both therapeutics and vaccines. The advanced therapeutics will come first, but in 2021, probably in the first half, we're going to get some good vaccine tools, and that'll be a big milestone.
This guy just skedaddles all over the place. He's all over the place. He never answers a question directly. He kind of just verbal diarrhea comes out of his mouth. We're gonna and phased and FDA they'll take care, and then the tools.
Milestone.
So next week marks a huge milestone. We have Operation Warp Speed is going to begin phase 3 for 4 of the...
For those of you who don't know, Operation Warp Speed was the incredible thing that, Trump signed that says, okay, fuck all the rules, just go ahead and make the vaccine. Tally ho. Might kill people. Even peanuts kill people. Even strawberries, really. Well, just do it, man. Tally ho, free reign. Take off the regulations.
These vaccines, right here in the U.S., they're trying to do 30,000 for each of those 4 vaccines, about 120,000 people totally. When will we know? How do we know if these vaccines are working?
Again, look at his face, man. He's just like, he knows that there's no...
Well, there's 3 things you'd like from a vaccine. You'd like it to be very safe in all the populations that you indicated for.
So again, he doesn't answer the goddamn question. When will we know? Well, around here, we're hoping for it. Basically, he doesn't want an answer that it's ever going to be safe, because it's not. So he dances around with some other bullshit.
No side effects. You'd like it to block transmission, and you'd like it to avoid the individual who gets the vaccine getting sick. The phase 3 endpoint is slightly different than those things, so that we can accumulate events quickly. So we aren't doing it like a long-term vaccine thing, and even calling it warp speed is scary.
I mean, this guy, just look at the body language. He doesn't believe his own bullshit. He's all over the map. Even a basic speaker learning like public speaking 101, okay? Toastmasters 101. The first thing you learn is a little bit of poise, a little bit of calm, bring the body in, use it when you want to. He's like a fucking skexy having a seizure. Look at him. She just says, when will it be ready? And he just verbally diarrheas all over the place. Watch this again.
They're trying to do 30,000 for each of those 4 vaccines, about 120,000 people totally. When will we know? How do we know if these vaccines are working?
No, he can just answer, well, around this time, hopefully we'll have some results. Or it might take longer than we thought. But nope, watch this. Watch this verbal diarrhea dance.
Well, there's three things you'd like from a vaccine. You'd like it to be very safe in all the populations that you indicated for, no side effects. You'd like it to block transmission, and you'd like it to avoid the individual who gets the vaccine getting sick. The phase 3 endpoint is slightly different than those things,
Bill.
so that we can accumulate.
Oh, Bill, and your
quickly.
humor.
So
Did you see him with that phase 3 endpoint? Oh, Bill. You silly Billy. This woman has no idea what the fuck he's babbling about right now. Right now, the producer is probably screaming in the ear of her earpiece, "Get him the fuck back! Bring him back! He's in the land of the dead! Pull him back in! Pull him back in! He's babbling incoherently! The animatronic is broken!"
aren't doing it like a long-term vaccine thing. And even calling it warp speed is scary because it suggests, that you're willing.
That's what's scary. Not having you be in control of something that you have absolutely no reason to have anything to do with. Actually, it's almost comical. If it weren't so deadly and it weren't really happening, I'd say we're in a comic book and a video game on an old computer that's made in the future, so it has newer parts. I don't fucking know. Let's continue.
Willing to make trade-offs against safety, which you should never be willing to do. The FDA is being pressured to allow what's called just a correlate approval. Fortunately, they've held the line on that to this point because we wouldn't know enough just based on the antibody levels.
Okay, so he's funny. He's like trying to look like a human and saying, "Listen, we tried to get this thing that would have been a really bad idea past the FDA, but thank God they held the line on it." So he's admitting, like, this is called, complete cognitive dissonance. He's telling you, we're fast tracking it, but that FDA is keeping us in check. He's telling you he tried to get something passed that the FDA supposedly said no to, or this could be complete bullshit. So he's admitting that they did something that's a bad idea and that the FDA stopped them and acting like proud of it. In what world? In what world is this form of news acceptable? Everything's a lie.
And, these trials, the bad news, of course, when we have many cases is good news for the trials in that they may accumulate events faster than they would have otherwise. But there'll be a lot of uncertainty about how good these vaccines are. The first generation, they said a 50% effectiveness, and they won't know the duration there. So these are going to be likely partial solutions that will improve over time. And so it's too bad, people think.
Look at him like fantasizing. Let me get a. Just look at this evil grin he's got over here. Where is he? Look at. He's like, oh yes, I am the emperor. Look at this face. He's in pure. When I rule the world. Yes, when I rule the world. Oh God, I just got her name. Shannon Doherty. Not Shannon Doherty. What's her name? This anchor. Look at him. Look at him in his drool. Yay. He really is like a Dr. Evil. It's like that ridiculous. I don't want to, sound like Alex Jones now, but Jesus Christ. He's like, fantasy, look how happy he is. We're supposedly in one of the bleakest and worst cases of viruses that the world has ever known, even though the CDC just kind of revised their numbers. And as far as I can tell, it is true. I've checked on that site. The way they did it is kind of tricky, though. It's kind of buried and you've got to search for it. But they revised all their numbers, and apparently 94% of the projection was wrong. So if they said it was 200,000, it was like 9 or 10,000 or under 14,000 that were really affected by really the supposed C-19. Oh, God. All right. Let's get this done with.
You know, people think that just that phase 3 approval will be the end of the epidemic.
Well, I want to ask you, you mentioned side effects.
She's going to hit him hard here. Get ready. I'm surprised they let her ask this question. Because what she's about to say to him is that look at, oh, I love my vaccine. So she's about to hit him with a really hard question. The amount of side effects in your, like, phase 2 trial, or I don't forget which phase it was in, had like an 80% or 100% really bad response, and like 8 out of 10 people who took it got like horrific side effects.
Side effects for the Moderna vaccine sound concerning. We looked. After the second dose, at least 80% of participants experienced a systemic side effect.
Okay, systemic means serious and ongoing.
Side effects. The side effects for the Moderna vaccine sound concerning. We looked. After the second dose, at least 80% of participants experienced a systemic side effect, ranging from severe chills to fevers. So, are these vaccines safe?
Again, look at the little perk, Dr. Evil Lips, and now watch him dance around this and never give a fucking answer.
Well, the FDA...
Yes or fucking no, Bill? No, they're not. They won't be. Well, the FDA, they, just listen to this.
Not being pressured will look hard at that. The FDA is the gold standard of regulators.
So he's not even saying that he's even trying to make it safe. He's like, we're going to just push whatever shit through, and the FDA will worry about safety. We just got to get these vaccines out. We got to get these patches out. We got to get everybody branded. We got to do it. The FDA, they'll, if it's unsafe, they'll inject some more stuff in there. It'll all be fine. Oh, don't you know?
And their current guidance on this, if they stick with that, is very, very appropriate. And the side effects were not.
Okay, you see him all over the place. He's just doing. He's like, fuck. She has me in a spot, and he just doesn't want to answer that. No, it's fucked, and we don't know how to fix it. So he's just dancing around, and the side effects weren't that bad, even though it was 80%.
Super severe. That is, it didn't cause permanent health problems for.
It wasn't super severe. You just had diarrhea, shat yourself, sweated, for 4 days. Not super severe. You didn't lose a limb or anything. Your head stayed on.
Or the things there. Moderna did have to go with a fairly high dose, and so to get the antibodies.
Moderna, by the way, is the name of the corporation. Once again, funded by Bill and Melinda Gates Foundation, as well as a few others. And they've never made anything. So they were open. Their whole project is this vaccine. They've never done anything successful whatsoever. I have a couple videos back. If you're watching this on youtube.com/blackoutsbox, please subscribe, hit like, share. If you can, donate. You can find all my links on in the comments down below. And if you can want to join Patreon to keep this content coming out. I usually do comedy. I'm getting a little dark here, I admit. comedy and consciousness, silliness and spirituality. There is a way for them to coexist, I believe. Again, if you can donate or join Patreon, that'd be great. If you can't, just share the links, let people know. Most people are asleep, stuff like this. They see the bullshit in the air right in front of their faces. Maybe it does something, maybe it doesn't, but I present it.
Some of the other vaccines are able to go with lower doses to get responses that are pretty high, including the...
Again, remember, she asked him, are these things safe? He's now so far away from that original question, hoping to just throw her off track, but I think he's lost some... I think he's like, what the fuck were we talking about?
The J&J and the Pfizer. And so there's a lot of characteristics of these vaccines. It's great that we have multiple of them that are
Bill,
going out there. And yes, I think
you know the data
US
better than I do.
government-
But Bill, the data showed that everybody with a high dose had a side effect.
Oh, he's like, oh, snap. I'm surprised they let her ask that question. I'm surprised. Like, I wonder, is this woman, is she fired now? This is about, I don't know, it's about a month ago.
Yeah, but some of that is not dramatic, where, it's just, super painful. But yes, we need to...
Some of that is not dramatic, where it's super painful. Oh, really, Bill? Thank you so much. You would hope that it would be non-dramatic. Where does he cross the line, you sick, twisted puppy?
To make sure there's not severe side effects, the FDA, I think will do a good job of that, despite the pressure.
How many doses of the vaccine?
FDA is going to fix my vaccine. We're going to put out... I spent a lot of money, and boy, am I happy playing with my plates at the world. And we're just going to make the vaccine. The FDA will fix it. And, yeah. Never answering, is it safe or is it not? Just past the question.
What we need.
Well,
missed that.
How many doses of the vaccine will we need?
Well, none of the vaccines at this point appear like they'll work with a single dose. That was
boy. Now it's
the
multiple
hope
doses.
At the very beginning. Maybe one of them, particularly in the second generation, won't surprise us. We hope just 2, although in the elderly, sometimes it takes more. And so making sure we have lots of elderly really people in the trial will give us that data.
You've said some more than 7 billion doses. That's what we'll need.
Well, if what you're...
7 billion doses. Now, if you think that he's just funding this with his little kind corporation, the money that this man stands to make, not that this is about money, this is about far beyond that, is absolutely insane.
Trying to do is block all the transmission, then you need to get, 70-80% coverage on a global basis. So that, it's unbelievably big numbers.
I mean, you're talking about a global vaccination program without a vaccine that hasn't been fully developed yet. And
go you, reporter woman, who obviously you can see she don't buy this shit. She ain't having it. I don't even know if did she let this slip by, because I'm very surprised that this is even still on the internet, to tell you honestly. CBS News pulled it down and had some edited version, but I was able to find the original.
A massive scaling up of how to produce one developed vaccination program. I mean, you're talking about a global vaccination program without a vaccine that hasn't been fully developed yet, and a massive scaling up of how to produce one or several vaccines. I mean, it's mind-boggling to think about this effort.
But the private companies have stepped up. The science has been advanced. The U.S. funds biological research more than any other country. We've stepped up to fund these vaccine manufacturers. The plants are being worked out now. In 2021,
He doesn't give a shit about if this vaccine does anything. He's just having fun playing Monopoly. We got the plants open, and like we got the factories going, and they moved the stem cells to the factory. This is like a kid with his toy set, and his toy set happens to be the human population.
There's a good chance this can get done, and because, this is about the billions that we need to spend.
Maybe we're all on Bill Gates's quantum computer, and he's like showing himself as this evil fucker. Oh my God, maybe we're on 14-year-old Bill Gates' shitty Windows Infinity system. Oh my God.
And to save trillions and avoid all those deaths.
But who's going to get the vaccine first?
Whoa! I ain't. I don't think she is. You gonna take it, Bill? Who's gonna get the vaccine first? He's like, yeah, fuck. Look at him. Oh, well, that's
in discussion. Clearly, the U.S., by funding factories in the U.S., will get.
How about you and your wife take it first, live on the air, with close-ups of the little microneedles going in you?
Priority. But if we can have other factories, and this is where the U.S. government's traditional generosity and global health will be needed, our foundation will be needed, other countries, we want to make sure that we don't have people dying just because they can't afford to have access to the vaccine. And so that speaks to the top priority of our foundation. And there's good.
So the top priority of the foundation is just to get as many vaccines out. Not if they work, if they're effective, if they're safe, if they do anything. We just need to make sure that 7 billion people get them. Bravo, Bill. Bravo, Bill.
Discussions going underway. The U.S. in this next relief bill may put 1% of it to make sure we stop the pandemic in the entire world, and then that draw
to make sure we stop the pandemic.
Other countries into that effort.
No, we need to stop the vaccine. He just flubbed on his own thing. Make sure we stop the vaccine.
I'm going to ask you about today, the government support, taxpayer money that's going towards vaccine development. Today, we learned Pfizer is going to get nearly $2 billion. Moderna receiving $438 million in taxpayer money. And yet both companies have said they will not sell the vaccine at cost. They're going to make a profit on it. Should pharmaceutical companies profit off this vaccine research that taxpayers have helped fund?
Well, the Pfizer case is more of a procurement.
Here we go again. Just just going to go off. I think I'm going to end this because he just goes off on his verbal diarrhea. Never directly answers. Just all he knows how to do is just a blah, 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 blah.
Agreement than an R&D funding agreement. AstraZeneca, Johnson & Johnson have said they're going to use a non-profit construct. The exact contracts that were negotiated, I don't have access to.
Oh, isn't that convenient?
Yes, you'd want to balance the fact who's taking the risk and who gets the benefit of those.
He did say who gets the benefit. So this is not a humanitarian effort. Who takes the risk? Who gets the benefit? Look at her face, this anchor. She is just looking at him with seething. Oh, I'm covering her. Hold on, let me take me out. She is just like, you lying prick. She doesn't buy any of it, and neither should you.
Those things. It's fantastic that the research is being funded, and I hope those agreements in terms of pricing and access are very strong.
I mean, we heard from the HHS secretary say today that the vaccine will be free for Americans, or affordable. So that means the government will help purchase it from companies that are making a profit off of that we helped fund the research for.
So she's calling them out in double profit. How did I miss this clip?
See any problem with that?
Well, some of the vaccines are being done by companies on a non-profit basis.
All right, you just heard it. Some of the vaccines are on my companies on a non-profit basis. Or is that what he said? Let me rephrase.
Being done by companies on a non-profit basis.
Yeah, that's what he said.
A few have decided, otherwise. And so if you have equivalent vaccines, the one that's the cheapest will be the one that we go with. And we may have, many choices here.
Notice the one that's the cheapest, not the safest. Because he's basically he's playing roulette wheel with other people's lives. He's not going to take this fucking thing.
That some of which look like, the production costs will be quite low. So I do honestly think both in therapeutics and in vaccines we'll end up that it'll be a very clear deal what should be purchased, and that'll be worked out.
Oh my God, I can't take it.
People second guess the early barter contracts. That's not really the key issue. We will get a good deal on the vaccine, and we need the world to get a good deal on it.
A good deal of bullshit.
Many of the companies have committed themselves to that.
Mm-hmm. The Gates Foundation is one of the largest funders of vaccine research in the world. Vaccines save millions and millions of people around
supposedly
the world.
Now you can see her face change. Like this is what she's supposed to read, and it sounds like look at her face. Yeah, her facial structure. She's just like, yeah, the Bill and Melinda Gates Foundation, blah. This is what she was just given to read, and you can see from her face where she was like suspicious of him over there, to when she comes back and she starts reading things.
Whether people second guess the early barter contracts, that's not really the key issue. We will get a good deal on the vaccine, and we need the world to get a good deal on it. And many of the companies have committed themselves to that.
Mm-hmm.
She's like, yeah, whatever, Bill. And now her entire, demeanor changes, and then it's like she has to read this. Oh, the work they've done. Bill and Melinda Gates.
The Gates Foundation is one of the largest funders of vaccine research in the world. Vaccines save millions and millions of people around the world.
Yeah, sure.
Every year. Are you concerned about a growing anti-vaccination disinformation campaign that exists?
Oh, she has to throw that in, disinformation. Because someone doesn't want something, it's disinformation. I don't want to put this poison into myself or my child. That's disinformation. And with that, I'm going to say bye-bye. Hopefully you have an understanding now of Dr. Evil here, Mr. Kill Gates. Mind-blowing. I'd love to, I have an intuitive sense and I can just see the lies. Almost anyone. I can't see how you can't. But I'd love for someone who actually, I have some skill in like where the eyes are looking, what a person's doing and everything, but I'm not sure this is a person even. Might be some Elon Musk AI shit going on. I don't know. But, yeah, I'm curious what you think. As usual, please make sure to subscribe and follow and set your notifications. And again, check the description below. And please, if you can, join the Patreon. Consider subscribing. $10 or more donation on paypal.me/Blackout Services. Description below. And I'll do a voiceover for you. I do thousands and thousands of voices. I do voiceovers remotely now. So there you go. You like this? This is called Dirty COVID. This is COVID. No shave. All right, guys. Love, light, laughter, kindness, creativity, abundance. For always, always. I'm Blackout. Michael Biggins. Peace.